My name is Karen Edwards, and I'm the director of the Community University Partnership for the Study of Children, Youth, and Families at the University of Alberta. I want to welcome you to the last talk in CUP's Issues and Impacts series. All our talks in this series are available on the School of Public Health's YouTube channel. I want to start our time together today by recognizing and speaking to the land we are meeting on. There are likely participants on our call from various geographical locations that reach across the traditional territories of many Indigenous nations. And honoring the land we are on and the footsteps that have walked these lands before us grounds us and acknowledges the importance of relationship. I want to acknowledge the land on which I am standing and the wisdom and footsteps that have marked it for generations. I encourage you to do the same. The place where I live and join you from today is acknowledged to be the territory covered by Treaty 6 and the Region 4 of the Métis Nation of Alberta, a traditional meeting ground, gathering place, and traveling route for many Indigenous peoples for centuries. By acknowledging this territory, I respect the histories, languages, and cultures of First Nation, Métis, Inuit, and all First Peoples of Canada that enrich my vibrant community. A treaty is an inheritance, a responsibility, and a relationship. We are all treaty people, beneficiaries of the peace and prosperity the treaty brought, and committed also to working towards the equity and justice the treaty promised. May recognizing our status as treaty people help us to be good neighbors to one another, good stewards of the land, and good ancestors to all our children. I want to share a few technical aspects for our session today. We've disabled all microphones and cameras to avoid any technical issues. If we're disrupted in any way during the session, please know that we have a support team in the background with a process in place to promptly deal with any issues. All questions for our speakers can be shared in the chat box or sent directly to a message to Sanait Johannes, and then they will be posed by our moderator. We welcome your feedback about our session, and Sanait will put the link to the evaluation into the chat box now, and I encourage you to not lose the link, so open up that link before we close off today. Now, today's event represents a multitude of celebrations. Not only is this the last of talk in our Issues and Impacts series, but it's also CUP's annual celebration event for 2021. And we are pleased to share the link to our annual report in the chat box. CUP is a research center at the School of Public Health at the University of Alberta. And for the past 21 years, CUP has worked closely with community organizations, researchers, practitioners, funders, and policymakers in Edmonton and across Alberta to identify issues of concern to the well-being of children, youth, and families. And in response to those issues, we collaboratively create research and evaluation projects, generate evidence, and mobilize it into practice programs and policies. This Issue and Impacts series has covered topics like community-based participatory research, early learning and care, transformational evaluation and capacity building, and today we'll focus on local poverty elimination initiatives in Edmonton related to inclusive economic recovery. And finally, today is also the This is Public Health lecture for 2021. And I am pleased to welcome two special guests who will be helping us support the focus of our talk today. Chancellor Peggy Garrity is passionate about words and ideas. She owns her own consulting company, working with organizations and individuals to facilitate conversations, address issues, clarify their purpose, and develop their unique brands. Peggy holds 2 degrees from the University of Alberta, a Bachelor of Arts in Honors, and a Master of Arts degree in Sociology. She's also a member of the Institute of Corporate Directors, and in 2013, she was awarded a Queen's Diamond Jubilee Medal. She was elected Chancellor of the University of Alberta in March of 2020, and she's the Honorary Chair of the University's United Way campaign. She'll be helping moderate our Q&A at the end of the session today. Welcome, Chancellor Garrity. And also we have Dr. Shanthi Johnson, who's the Dean of the School of Public Health, which is CUP's home. I will ask her to introduce our last talk and its connections to the School of Public Health's This is Public Health Speakers Series. Shanthi.
Wonderful. Thank you for the warm introduction, Karen, and good afternoon, and welcome to those of you who are joining us for today's This is Public Health lecture, entitled An Inclusive Economic Approach to Ending Poverty. Welcome also to our partners, donors, and alumni who are with us today and who hold such an important place in our community, in our research, and in our work. And I especially want to thank Chancellor Garrity for agreeing to moderate this lecture for us. As Karen outlined, this lecture is part of the Issues and Impact series of the Community University Partnership for the Study of Children, Youth, and Families, or CUP. CUP is a world-class research center, and we are delighted they became part of the School of Public Health in 2020. We value the impactful research and expertise, and today's event is an excellent reminder of the crucial work that CUP does, both on campus and at the broader community in Edmonton, Alberta, and beyond. This is Public Health Lectures were created for us to learn and to think critically about public health issues. Public health encompasses so much. It aims to protect health and to prevent illness, and it works to ensure all people have equitable opportunities to enjoy good health and well-being. Public health is about sustainable systems, policies that create healthy environments, and harm reduction for those at risk. And the pandemic has further highlighted that there are so many important, challenging, and necessary components of public health. And we are very fortunate to explore several of these components in today's lecture, an inclusive economic approach to ending poverty. Today's first speaker is Dr. Maria Mayen. She's a professor at the School of Public Health and CUP's Associate Director. Dr. Mayen's area of inquiry includes addressing poverty and other forms of disparity that we see in our communities. Her community-based research interests are in the area of partnership and knowledge translation, and how citizen, community organizations, clinicians, governments, and universities can and should work together to address disparities and improve health outcomes for all. And she's also very much involved in the study and development of the qualitative research methods that underpin the work. Today's other speakers are Brooks Hanovich and Susanna Cameron, managers of the strategic initiatives with the Poverty Edmonton Secretariat. Poverty Edmonton is a community initiative working towards prosperity for all through advancing reconciliation, the elimination of racism, livable income, accessible and affordable housing and transport, affordable quality childcare, that is an issue in our communities, and access to mental health and addiction services and supports. CUP has collaboratively worked with community partners, engaged with EPE since the Mayor's Task Force to Eliminate Poverty way back in 2014. Since that time, CUP has been responsive in providing community-based participatory research and evaluation expertise, evidence for decision-making, and ongoing engagement with EPE partners. We are excited to hear from Dr. Mayen, Brooks, and Susanna, and to have an opportunity to engage with their content later in the program, moderated by Chancellor Garrity. So without further delay, I will hand today's lecture over to Dr. Mayen. Dr. Mayen?
Thank you, Dean Johnson. And thank you. Thank you. I don't think that's the first slide, but that's okay. Thank you for everyone joining in today. Dean Johnson and her team for highlighting our work as this is Public Health Lecture. Karen Edwards, my dear colleague from CUP, organizing this over 10 months ago. Our esteemed Chancellor, Peggy Garrity, thank you for moderating today, and for Brooks and Susanna for joining me in presenting our topic. And we are, is the PowerPoint coming up? Great, thank you, that's it. So you can go right away to slide 2. What I really want to share with you today is how EndPoverty Edmonton, Dean Johnson talked about all of our game changers. We're focusing on our livable incomes game changer, which is really an area of activity. And how the livable incomes game changer is influencing economic recovery to build a more inclusive economy. And then connect this work As poverty and as public health practitioners and scholars, all of us on the call who act every day to protect and improve health, especially for those living in disadvantaged communities. So before I start our story, I want to let you know what we won't cover today. Next slide. Which we may be grateful for is the significant history behind Poverty Edmonton, which I would probably, if I could, start telling with a study I co-led for 15 years called Families First Edmonton, but won't go into this. The only take-home message from this slide is one that you will all be familiar with, is this kind of work addressing chronic social and health issues happens over the long term. So poverty is an extremely frustrating area to work in. We often hear, we know the problems. And these problems are extremely well documented across major initiatives, including the social determinants of health, the Sustainable Development Goals for the planet, they're called, and our own EndPoverty Edmonton's Game Changers. So we know that a low income, for example, that a lack of housing, that a lack of access to health services, all have poverty at their core, and these lead to poor social and health outcomes. The squiggly line there links what we want to talk about today. So income under the social determinants of health, through the Sustainable Development Goals, which number 1, I know you can't read, is end poverty, but number 8 is promote inclusive and sustainable economic growth, employment, and decent work for all, through to our own EndPoverty Edmonton's Game Changer, livable incomes. So indeed, we do know the problems that are highlighted here, and we don't need any more research that says, if you don't have a good income, you're at risk for bad social and health outcomes. And so all of this, us in this area often say, I am so sick of saying the same stuff over and over again. But there is a very stalwart group, Karen, next slide, that I would like to introduce you to. Quickly, very quickly, on the EndPoverty Edmonton side are my dear colleagues, Susanna Cameron, Sarah Barber, Brooks Hanowich, Eric Antman, Andrea Danini, and Karen Bruno. And on the CUP School of Public Health side are Kirsten Morley, Janelle Knoop, Alexa Fernandez, and Alfredo Conda. And they have built on the previous work of a team, including Bethan Kingsley, Sherma Das, and Emma Wallace. So this group are the doers, like many of you. They're the interventionists who know the problems of poverty, but are testing and studying the paths to solution. And we're doing it alongside, but not exclusively with the social sector. For the longest time, the prevailing thought was that poverty needs to be solved by the social sector. Just get those social workers on it. And, by the way, what's taking you so long, social workers? But the social sector cannot do it alone. And this is where the uniqueness of EndPoverty Edmonton comes in. EndPoverty Edmonton is not a not-for-profit. We do not deliver programs and services. We instead are a convening body that works from a systems approach with various and atypical partners that are beyond the social sector to enable actions to end poverty in our community. So in the economic space, our goal through the Livable Incomes Game Changer is to develop systems to ensure everyone in Edmonton is earning enough income to take care of their needs and fully participate in their community. This work is guided by 2 lenses, an inclusive economy lens and an economic reconciliation lens. And the tools and tactics we are using, or how we are working toward the goal of livable incomes, is through briefs, writing briefs, an analysis of economic recovery plans, and work on living wage, basic income, social procurement, Indigenous procurement, and workforce development. So the first lens, an inclusive economy. Next slide. Thanks, Karen. Thank you. An inclusive economy is an alternate framework for understanding the economy, which is really in response to our knowledge and our experience that equality in society is just bad. It's bad for health, bad for political stability, bad for social cohesion, and also, though surprising to some, it's very bad for economic growth and innovation. So the goal of an inclusive economy is to raise the standard of living and create widespread economic prosperity for all members of society, especially those living in disadvantaged communities, while ensuring not one group benefits while another is harmed. The other lens is economic reconciliation. Susanna, over to you on this one.
So as Maria said, we're not going to talk a lot about the structure or governance of Poverty Edmonton, but I am going to take a step back and let you know about the Indigenous Circle to explain how we developed our economic reconciliation lens. So Poverty Edmonton was launched in 2016, but even prior to that, 3 years before, there was a lot of engagement and early stage development, and that's when the Aboriginal Roundtable was first convened in about 2013. And that table came together to inform and shape Edmonton's plan to eliminate poverty. The table still exists. It's called the Indigenous Circle now, meeting monthly. And it's an integral part of Poverty Edmonton's structure. So the Indigenous Circle advises, informs, and influences the work of Poverty Edmonton to ensure that reconciliation is considered and implemented right across the strategy. And one of the major projects of this circle is the Indigenous Culture and Wellness Center in Edmonton, which is just finishing up their business case for the center right now. So before we started our work on the livable income game changer about 18 months ago, we worked with the Indigenous Circle and other staff at Poverty and two consultants, Colleen Mustis and Sangeeta Stickings, to develop our economic reconciliation lens and embed it within our overall strategy for the livable income game changer. So I've got an infographic that Colleen Mustis and Sangeeta developed. And they looked and did research into economic reconciliation, research in kind of non-Indigenous terms and the literature, but then also looked at Indigenous cultural values. And we're looking at how those two components were connected, emphasizing Wakota Chwin, that everything is interrelated. And so we are taking this lens and and going forward with each of our tactics and trying to embed this work going forward.
Thanks, Susanna. And so what is particularly exciting about our work is the timing is right. In addition to truth and reconciliation and economic reconciliation, Black Lives Matters and other movements, there was initial awareness even before these movements and even prior to COVID, actually, that we had a serious economic problem with few ways out. COVID only heightened this with essential workers, served, which people are kind of talking about, was that a basic income pilot? And really looking at, it's an opportunity for an unprecedented analysis of what employees actually need. So there's numerous help wanted signs out there and everybody's making assumptions about that. And everyone is putting out economic recovery plans. And so for us as a research team, it was widely recognized before COVID that there was little research documenting attempts to develop and implement policies and practices that support an inclusive economy approach. But COVID has only made our work more relevant with increasing number of organizations and companies wanting to work with us. So one of our first steps as a research team, and one that continues to be needed, was to develop briefs on topics that Poverty Edmonton needed when meeting with industry on others. So for example, we had to nail down what is considered a good job, what is social procurement. Another project that we're currently doing is to advance the livable incomes game changer is an analysis of poverty-focused economic recovery plans, including interviews with key stakeholders on how they're using a poverty lens in economic recovery conversations. Basic income is a third area of focus. Over to you, Susanna, for the basic income.
Thanks. So when we're looking at different tactics and strategies, sometimes it makes sense to work within Edmonton, but sometimes it makes sense to work within Alberta or even nationally. So basic income, the concept is a monthly upfront cash payment delivered unconditionally to all individuals to cover the essential cost of living. Most people agree this would probably work from the federal government, maybe in tandem with the provincial government if it were to be implemented. So EndPoverty Edmonton is an active member of Basic Income Alberta, and we're connecting with other advocates right across Canada for that work. And Basic Income Alberta focuses on advocacy, education, and local mobilization. I encourage you, if you're interested, to check out the Basic Income Alberta website, and there are monthly meetings you can join. Another tactic that we're working on is living wage. And so the living wage that an employee is paid is reflecting what a family, and in this case a family of 4, the way we've calculated it, need to bring home to cover their actual costs of living in a specific community. So it's different from minimum wage. It could be the same, but minimum wage in Alberta being $50 an hour. And so we're calculating for different municipalities across Alberta what the living wage is, and it does look different in Lethbridge than it would in Canmore, for example. Again, we're working provincially on living wage, and that is a group called the Alberta Living Wage Network. Again, encourage you to go to the Living Wage Alberta website to get more information. We're about to launch probably in the next month the numbers, the living wage calculation, and we're excited this year too because we're going to be accrediting employers who are paying a living wage. So that's an opportunity to be recognized as a living wage employer. And that group are also working, there's living wage groups in British Columbia and Ontario, so we're trying to calculate living wage in the same way right across the country and do that advocacy work across the country.
Yeah, so I will talk about another tactic that is near and dear to mine and Susanna's heart, I think, which is social procurement. Susanna and I kind of eat and breathe social procurement every day, so I'll try my best to explain this very simply. So social procurement is really about embedding social value criteria into purchases that governments, institutions, and businesses are making on a day-to-day basis. So if you think about procurement from an institution, for example, or a government like the city, oftentimes the assessment they would do on their bids and tenders would be the lowest cost. And what social procurement says is to embed social value criteria into those bids and tenders and weight them. So you're not just going with low cost, you're actually looking at what the social impacts would be on the community. So social procurement, we say, aims to achieve the greatest value instead of just the lowest cost. And the way EndPoverty Edmonton looks to work in this area, we are supporting social enterprises, small businesses, and diverse businesses in Edmonton to be able to respond when social procurement is embedded in a tender from someone like the City of Edmonton or an institution like a university. We're also looking to increase access to jobs and provide employment and apprenticeships and skills training. So oftentimes when social procurement is embedded in a tender, companies that aren't social enterprises, aren't small businesses, large, let's say construction companies will be bidding on this, and they'll be looking to figure out how to respond to the social value criteria that's embedded into that tender. And then we're also working to maximize community benefits, including community employment benefits. So community employment benefits are, frankly, another way to say social procurement. It comes from the federal government, and this is attached to large infrastructure dollars. So when the city, is building the LRT, that will have federal monies attached to it. And with those federal money comes this community employment benefit, which essentially puts criteria for hiring populations that face barriers to employment into that tender. And so the companies bidding on those projects are working with us to ensure that they can, effectively and efficiently respond to that. So they can hire from Indigenous populations, they can hire youth, they can hire newcomers. And so we work in those 3 areas. And next slide. So the tactics we're taking, so we're identifying institutions, industry purchases conducive to social procurement. One thing I should say is that we really see ourselves as on the implementation side of social procurement. So there are organizations, national organizations that work on a policy side. So we work closely with a group called Buy Social Canada. They help to build out the City of Edmonton's social procurement policy. So how those policies are embedded in their processes internally. We work, once those processes are in place, we're working on the implementation side. So how are, these institutions deciding which procurements to make, and then how are they connecting in with community? I'll also say that the City of Edmonton is currently developing an Indigenous procurement policy as well, and that's with an Indigenous advisory committee within the city. So that work's being done, and we're sitting on the other side looking at, okay, once these pieces are in place, how do we help them to be implemented? And really that implementation looks at linking demand, so the social procurement opportunities when there's a bid, when there's a tender that has social procurement embedded in it, that with the community supply, so that there's a strong, robust community response to the bids that are out there. And again, that's working with social enterprises, small and diverse businesses, but it's also working on workforce development, ensuring that people looking for employment are able to find these companies and get jobs. And then finally, it's not as easy as just connecting kind of the demand and the supply, right? Those connections often have a lot of systemic barriers within them. So it's talking to all the groups, and where this becomes really interesting for us, and you saw the slide on engaging systems, social procurement really allows us to look at all the elements of the system. So you have, for example, a municipality that's embedding social procurement. You have industries that are looking to satisfy those social procurement criteria. And then you have community organizations that frankly are the ones who are going to connect community into those companies. So it really allows us to look at all the elements of the system and start to look at where are there real systemic barriers there and how can we collectively address them. And obviously there's associated research attached. Maria, I'll turn it over to you.
Yeah, I think you identified what we are doing with the research in the social procurement space, Brooks. Thank you. It really is tracking everything that Brooks mentioned. So tracking those requests for proposals from the City of Edmonton, identifying the themes and what's happening there, documenting and analyzing connections between industry and community organizations, and as Brooks said, examining those systemic barriers, the policies and practices limiting social procurement. So we walk alongside our colleagues in EndPoverty Edmonton to analyze the convening and what they're doing for social procurement.
And I'll just say that the supply side is fairly robust in Edmonton, and we're working with groups like the Africa Center, with Business Link, with a number of workforce development organizations like the Edmonton Mennonite Center for Newcomers, Action for Healthy Communities. So really on that community side, it's mobilizing them to be able to respond to this. Next slide, please. So this isn't necessarily a direct connection to social procurement, but it certainly is part of all that work. So we're working in what we call workforce development and looking at removing systemic barriers and improving coordination of training and employment opportunities. So you can see with the graphic there, we're working with essentially three kind of major nodes in the system. So we're working with workforce development organizations, and most of those organizations, if not all, have mandates to create inclusive work environments, develop efficient employment connections, and explore policy options and knowledge mobilization around workforce development. So how to get people effectively into jobs. And we're working with those workforce organizations to really start to leverage the strengths in that system, to figure out who's doing what in the city, and then how can we support them to share their knowledge with each other, to look at, let's say, barriers that might exist around funding or communication or any of those pieces. So really working with those organizations. And along with that, working with the training and education institutions that a lot of these workforce development organizations will already work with, but just ensuring they're aligned with the other node, which is industry and business. So we're seeing a lot more uptake and interest from industry and business in connecting with community, in connecting with these workforce development organizations. And you'll see in the bullet points a lot of this demand is coming from, one, the increased social procurement. So we're hearing from companies that are saying, we now see that we need social value criteria from tenders and bids that are coming out from the city. So how do we do that? The second part is we have, COVID restrictions on the mobilization of labor. So often companies might go to the East Coast, they might go for temporary foreign workers to satisfy their labor needs. And what we're seeing is, that's not available. And so they're more and more interested in building a local workforce. There's also, frankly, some larger trends, which are aging workforces. So these companies and particularly like trades and trade unions are recognizing that a lot of their staff and a lot of their labor pools are 55 plus. So that window is closing and there aren't a lot of new younger people coming into those jobs. So, they're starting to think about where are there other labor pools, where are there other more diverse groups that can fill those roles, and then a younger workforce demanding social responsibility. So we're seeing kind of the new executives coming up, let's say that middle management, maybe moving to the executive class, really demanding that their companies do more and do more for the community. And so it's, again, why this is an interesting systems approach is that you have these workforce organizations which have a mandate to connect people to work. You now have industry that's actually, I think, much more interested in working on this. I mean, a lot of companies have done this in the past and been thinking about this, but I think we're getting more kind of uptake. But really, there are a lot of systemic barriers in there. And the working idea that we have is that those groups need to come together to talk through where the barriers are in the system, and no one element of this is going to be able to solve this alone. So just a really quick example, if I do have time, we've been working with the Ironworkers Union, a number of ironworking companies and workforce development organizations to figure out how to, one, make ironworking more attractive to people, let's say newcomers, two, share the information, because what we see is workforce development organizations are saying, we have people here that have trade backgrounds, they're interested in trades, and the ironworkers unions going, well, they don't show up at our doors. So why is that? And we're thinking it's likely a communications issue, but there's a number of like training issues and systems in place that are just huge barriers to keep newcomers from moving into trades. Where that's really interesting is independently, none of these groups could really figure out how to solve that or even start to think about it. But in a room together, they can start to go, wait a second, you have people, we have demand, what's going on here? And so there's been some really interesting conversations around, looking at the apprenticeship system and where the barriers are in the apprenticeship system. And can we have longer timelines and things like that for people to move through the apprenticeship system before having to go to school, which may be a problem if they have lower English level language. And the one thing I'll say too is that these different nodes each have experts in them. So we're not the expert. I'm certainly not the expert, but getting these people together to talk, you get a much deeper understanding of what the nature of the system looks like and where the problems might be. And again, there's associated research with that. So I'll turn it over to Maria. Next slide.
Yeah, thanks. So again, just reiterating what Brooke said about research. So studying the practices that he was speaking to, the Workforce Collaborative or the Iron Workers, what is needed to recruit and retain. That's an important aspect. A lot of focus is on recruiting, but what about retaining individuals from diverse communities, from perspectives of those organizations, from the perspective of the ironworkers, as well as from the individuals in the diverse communities. And then what, from our public health perspective, what are the health and social outcomes for these individuals? And other questions like, what are the conditions needed for a good job, a good job that not only pays a livable wage, but perhaps has some benefits, has sick leave, has vacation leave, those kinds of things, EI. So we're studying, again, walking alongside our colleagues in EndPoverty Edmonton in the workforce development space to understand those and answer those research questions. Next slide, Karen, final slide, actually. That was our current work on the Livable Incomes Game Changer and how we're working with systems, as Brooks and Susanna mentioned, to ensure everyone is earning enough income to take care of their needs and fully participate in the community. In particular, our CUP and EPE partnership is working to ensure First and foremost, that people are at the core of all economic decisions, so that they do not lack, nor are they denied the economic, social, and cultural resources they need to have a quality of life and meaningful participation in the community. And we'll end it there. Thank you.
Hello, everyone, and thank you so much for all of those. It was really interesting to me, because I will admit that I think since the Mayor's Task Force, I haven't been as actively involved, and so I'm really pleased to hear. I'm just kind of wondering where the questions are going to come to me, because I haven't seen them yet. If I have to check into the chat room, I'm happy to do that. But maybe just while I'm waiting to get your questions, and I hope there's lots of them. You know, the toughest question of all, maybe Maria and others, is I got your message at the very beginning that all of you, and especially all of us, I guess, are really frustrated. The same, we know the answers. We know the problems, and yet it continues to take a long time and be frustrating, I think, to get the momentum that I think we all would like to see. So, you know, in your wildest imagination, you know, what would it take? What needs to happen? Who needs to make it happen in order for all of us to see the momentum that we would really like to see? I know that's an impossible question, but it runs through my mind all the time.
I'll start, but Brooks and Susanna and others. I think first of all, actually, I have to note that that convening organization aspect of End Poverty Edmonton, it is a very, very unique model. And thanks to our funders for actually, and for the Mayor's Task Force for actually creating that entity. So like I mentioned, it's not a not-for-profit that has, you know, its goals that have to report at the end of every year how it helps so many individuals, you know, according to the goals of the organization. It truly is a convening body that brings those nodes together that Brooks was talking about. Who needs to be in the room, which disciplines, which organizations, which educational institutions, what industry, on and on, need to come into the room to start having the conversation about making links. And sometimes it's not that difficult, right? It might just be adjusting an English language testing, or when that testing happens. So it's bringing those people together to have those conversations. So, you know, kudos to End Poverty Edmonton's initiation, where it developed this as a convening body. I think is a huge part of this. Brooke, Susanna?
I just say that, you know, as you've been saying, there's often reports come out with recommendations, 36 recommendations, but it's really, how are you going to implement them? And is there funding and support for that implementation? And often long-term, it's not often something you can make happen in 6 months. So I have been thinking about that a lot, and how long and sort of hard you have to keep working on it. And then kind of recognizing, and I've done frontline work, is often, I think the frontline workers know what the issues are in the system, but you're so driven to help your clients and reach particular outcomes, it's really hard to take that moment and step aside and convene people and say, you know what, we're all doing the same thing. This piece of the system's broken, but we don't have to, because we've got to meet certain outcomes, or we don't have, you know, literally time, resources to have a side conversation and go, look, these 3 things are not working. We need to do them differently. How can we do that? And so feeling very grateful at End Poverty that we have that moment to kind of step out, or you know, fly up in the plane and look down and go, wait a minute, where are the bits that on an ongoing basis are causing problems? And we have that opportunity to have a conversation and attempt to fix it. And often there's very large, you know, forces or things have been done this way for 40 years or whatever that is. Or, you know, there's a regulation or a policy or something in place that you've got to figure out how to navigate around.
Right. Brooks, anything to add to that?
No, I can't say. I would say something a lot less eloquent, which is it's also very unsexy and a grind. And I think that oftentimes we tend to look at the shiny things or the sexy things, and that keeps us in maybe a theoretical mode when the actual work on the ground is a grind and getting people right. It's not something that you can honestly even do a talk like this about and make it really sexy and appealing, but that's where the work needs to be done, I think. And so
it's where the hard work needs to be done. I'm going to flip to some of the questions now. Thank you. I'm getting them all. So, and there's lots of them, so we'll have to go quickly. This is a question that was raised, I guess, in the last talk, but it's also appropriate to this one. What strategies is Alberta using to engage with the Black people in the province as part of End Poverty Edmonton?
That Alberta is using? Yeah. Sorry, just want to clarify the question.
Yeah, it was Alberta.
I can probably, or Susanna, you can probably speak to what End Poverty is doing to engage the Black community.
Yeah, not so much from a provincial point of view. So we've been working on livable income, this game changer, for the last 18 months in the context of COVID. So a lot of the work we have been doing, as Brooks described a bit, has been at the organizational level. So for example, when we're reaching out to organizations that provide entrepreneurial supports or employment supports, it would then be some of them are Black-led organizations, some of them are organizations that work with diverse populations, but may have strategies that are specific to the Black community, or staff members or programs. So that's been a main level. Unfortunately, it's been really tough in the last 18 months to work directly with community. There's some ability, and as I mentioned, we do have an Indigenous Circle table, but we don't have tables for other communities. And if we were able to grow and broaden, that would be an exciting opportunity for us. Right.
Super.
Yeah, and I think to add, sorry, Brooks, I think to add on our stewardship roundtable, on End Poverty Edmonton stewardship roundtable, we have diverse individuals sitting around that table. It's kind of the governance or the leadership table, and including Black individuals directing our work from that perspective, but a whole bunch of diverse individuals at that table. Brooks?
Anything to add, Brooks?
No, I'll just say that we do rely on community organizations based on the way we're situated, and we have a small staff team, so we do have to put a lot of weight and a lot of time into working with organizations that then have that reach into the community, and so that's been our tactic so far. I think there is a question as to whether that's the best approach, but right now that's the approach we've taken, and I think something that we'll, with our research team, continue to examine as to whether or not we're actually reaching into diverse communities through these organizations.
Super, thank you. This one probably for you, Maria, because I don't know the answer. Does the university have a social procurement policy?
Great question, and I could turn it. We had a chat about social procurement this morning from 9 to 10, and I know one of the individuals I introduced you into the slide, Alexa, went to that this morning to specifically ask what's happening. Brooks and Susanna and myself went probably a year ago to our social procurement leads to say, hey, we should have a social procurement policy at the University of Alberta, and talked about, well, Grant MacEwan's doing it, so U of A better. And I understand that conversation had, we didn't have another meeting after that. And, but so Alexa asked this morning, and supposedly we do have one, but there was, they didn't send her the link and she couldn't find it after. So I understand we do have one, but it might not be. And it goes actually really back to what Susanna was saying. It's the implementation, right? It's the work of the implementation. So you have a policy, but if nobody knows about it or is really following it through and making sure we're doing it, then we've got a problem. So I guess U of A does have one.
Might be a question for us to ask, Maria.
Good one. God, put that on your list to do.
I will. I'll put that on my list. The next one is, are there any specifics on what is being done to remove barriers to older workers?
I don't know that we've gotten into work with the seniors community yet, or barriers for. I know there's organizations doing that work, but Frank, so the way on the workforce development side, the way this formed was we first started working with a group of workforce development organizations that primarily work with newcomers. And that was for a number of reasons. One, those organizations had kind of stepped up and made themselves known to us. And we, Susanna and I both also had a background with some of these organizations. So we were able to reach out and kind of talk to them first. We are now working with a number of Indigenous workforce development organizations using that same model you saw, like the same kind of simple graphic. But I guess what I'll say is that I think the same process and model can be used. Like if there's, I know that seniors organizations and seniors employment isn't as, I think, like the foundations aren't as strong necessarily. Like I don't know of a number of community organizations that are doing that work. Like I've talked to Sage in the past about it, and I don't think that there just isn't as much of a focus, right, on employment as you would have for, let's say, youth or something like that, right? But certainly that same model, like if there is demand from the community and there's organizations that are looking at seniors and connecting them to the workforce, I think that same kind of connection can be made and bringing them in and looking for the industries that they might want to, might be conducive to seniors employment and those types of things. Certainly like ironworking, I don't think is probably a great one to focus on. From the sounds of it, it's very difficult, but yeah, physically. But yeah, no, I think the same model can be used. And that's the real, to make a long story long, I mean, that's the real, I think, value of the work that we're doing as well, is that being able to test these models, I think, can scale really nicely to other areas, be it other industries with certain groups, but other community or community groups that are looking for connections into work. Susanna, any other piece there?
No.
We're going to go really fast because I've got a big list here. Otherwise, I'm sure that we can follow up after. Has there been a significant amount of research done in how free or affordable childcare could help women enter the workforce? Many jobs like trades don't have flexible schedules that may be beneficial for caregivers.
Yeah, all of this stuff is so interrelated. I mean, that's why, we have the social determinants of health. We have all of, the game changers. It's all, you can start the conversation at any one of those, and they all will come into the conversation in some way. What is really exciting is, I don't know if you remember the slide on the economic recovery plans. A lot of those focused on women, getting women into the workforce. And of course, number one is childcare. And Poverty Edmonton has an early learning and care steering committee that have spent an astounding amount of hours and energy and speaking with groups to also develop an affordable and high quality early learning and care community, and so are really pushing from that perspective. And so we work closely with them. But yes, it is number one in a lot of those economic recovery plans, what to do for women. Yeah, something we really need to keep pressuring our governments on.
I will say personally that it's about time, but honestly, also it is one of the good things that came out of the pandemic, and its impact is a real awareness of how critical childcare is for women in the workforce.
And Peggy, actually, if I could just mention on those economic recovery plans, get women, how the pandemic affected women and work. Another significant theme through all of those recovery plans, even if it wasn't focused directly on women, was make sure you're making decisions from an intersectional lens, from intersectionality, which was also very progressive and nice to see in those plans.
Super. I see that there's a request from the critic for seniors for official opposition, just loving if there's more info on support for seniors. So if we do have more of that, we'll make sure to arrange to share that. Have you been able to get the perspective of those living in poverty to see what they see as obstacles and what criteria they have for a good job?
Brooks and Susanna, do you want to, it is really about relying, what Brooks was saying about relying on our organizations that we work really closely with. I don't know if you want to add to that, Brooks and Susanna?
Yeah, sorry, I was just making a note as you asked the question. Sorry, I missed it. And this is so looking at people with lived experience
from their lens, and what would they see as the barriers, and what do they see as a good job?
Yeah, to Maria's point, again, another belief that I have, and I believe Susanna shares this as well, is that the experts are really within these community organizations, and not all organizations are created equal, but we are trying to rely on the work that they do and the connections they have to the people that they support. So really looking to them to provide that, that perspective, and to tap into, frankly, just the loads of work that those community organizations have done with the people that they support. Again, there is likely a question at some point, is like that the best model to go with? But I think that we're, so far what I've seen is that these organizations do have a pulse on what's going on with the people that they support. And I think that that's been fruitful so far. Susanna, do you have any other piece?
Well, I'd just say that has been a goal for a long time for End Poverty Edmonton, to have a group of people with lived experience, and we are striving for that. And we do, like, it's working with the Indigenous Circle, for me is really, really important, bringing an Indigenous voice or perspective or conversation to our work. And so that is something we'd really like to do. It has been super tough in COVID to do things over Zoom with everyone, but I think that is a place we'd like to go and do a better job of that in the future.
Mm-hmm.
And just from a research perspective, we're putting in a grant right now that is going to be working with individuals from lived experience.
Okay. I'm conscious of the time, and it's my horrible job to cut things off at 12:55, and I now have 12:56, and I have 6 more questions. So I'm going to do that horrible thing and cut off the conversation. I'm sure it could happen. It could continue on for the rest of the afternoon. I do have a list, and Sinait has been great at compiling all your questions, so we have them, and we'll answer them and share them. So now I think I'll pass it back to Shanthi and Karen to close up today's really informative conversation, and I hope and know the beginning of lots more to come as well.
Thanks, Chancellor Garrity, and thank you, Dr. Maya and Brooks and Susanna, for such an engaging and informative lecture. Your work truly underscores the importance of public health, especially those root cause issues such as poverty, persistent poverty, and inclusive economic approaches we know works and that we need to implement, such as the basic income, living wages, and social procurement, a lot more deliberately and thoughtfully. Your public health also is multi-layered, systems-based, and your presentation again today in partnership with End Poverty Edmonton clearly highlighted that multi-layered, multi-partnered approach that we take in our school. We are grateful for your insights today and for all that you have shared with us this afternoon. And the beauty of public health is that it works in that operational nexus, connecting research to community, industry, and other sectors that come to bear to address complex problems to find innovative solutions. Please note that this lecture has been recorded and will be available on our website in the next few days. Please bear with us as we sort of work through the technical background work that needs to happen before it goes on the website. You can also access past This is Public Health lectures on other complex and challenging issues such as water or value-based decision-making and others on our website in the same section as well. And we invite you to take advantage of this engaging, publicly available expertise at your own time and convenience from our website. We are particularly grateful to Chancellor Geraghty for her involvement today and for moderating the questions. Thank you, Chancellor Geraghty, for joining us. She is so busy, and her commitment to this lecture really shows the importance she places on the root cause issues such as poverty, not just now, but for a long time working in this area, and the partnership that we have with our community partners. So thank you so much for joining us. As I mentioned earlier, we welcome all of our participants to complete the event survey. The feedback that we receive helps us refine our future public health lectures. And Sinait Johannes will post the link to the survey again in the chat box. It was sort of put in early in the conversation. And again, the link will be shared so you will have ready access. And thank you all for your participation and have a wonderful day, a wonderful afternoon. I'm going to pass it to Karen for just a couple of last comments before we finally wrap up.
Just a line to say thank you. This is number 8 in our Cup Issues and Impact series, and it's been a fantastic ride, a way for us to celebrate our 21st year. And it's been a really tremendous way to end it out. We have more questions that we could get to, and we will actually go through and try and answer those. You'll get a link from Eventbrite because you registered, so you'll get the link to the lecture you'll get, and we'll try and actually respond to some of those questions too, because there was a lot of very good questions. Thank you so much for helping us finish up our Issues and Impact series with a bang. And thank you to all our presenters and to Shanti and to Chancellor Geraghty. It's been fantastic. Stay well, be safe, and have a great day.